Okay, so thank you very much first, Don and Barbara, for the kind invitation, which allowed me to tell some words concerning what we did in the field of anti-inflammatory properties of Phosphorus Dendrimers. In fact, I will divide my talk in 3 different parts. First, I will show you one example of the anti-inflammatory properties of polyanionic Phosphorus Dendrimers. Then the next step will be anti-inflammatory properties of polycationic Phosphorus Dendrimer, small interferon RNA dendriplexes. In this case, the dendrimer is acting as a cargo. And then we will see anti-inflammatory properties now of neutral Phosphorus Dendrimers. So just have a look to the activity of polyanionic Phosphorus Dendrimers. For that, we were working with a compound, we call that hit number 1, that is to say the dendrimer generation 1 bearing 12 in red, 12 other bisulfonic group, and we have here perfectly water-soluble compound, easy to prepare. We start with the dendrimer generation 1 with 3 with PSCl2, substitution reaction with this phenol bearing other bisphosphonate, and the last step is the hydrolysis of the PO bond here using bromotrimethylamine and sodium hydroxide, leading in quantitative yield to this kind of dendrimer. And first of all, we were able to demonstrate that starting with this compound, we show a dramatic amplification of the number of natural killer cells, which are, as you know, the first line of our immune system. But now, just changing, grafting on the same dendrimer fluorescent group, such as fluorescein, we were able to show that the dendrimer is recognized by one of several receptors on the surface of monocyte. And as you can see here, for example, we have the monocyte in red, the dendrimer solution in green, and you can see that after 60 seconds, we start to have internalization of the dendrimer into the monocytes. So it was interesting. We were able, therefore, to demonstrate that the dendrimer induces amplification of natural killer cells, but also is immunosuppressive, that is to say anti-CD4+, anti-inflammatory, and anti-osteoclastic. So when you can see these properties, you can think about to use these dendrimers for fight against rheumatoid arthritis. As you know, rheumatoid arthritis is concerned with bone resorption due to the increased activity of osteoclast, then to cytokine disorder in the bone junction with a chronic inflammatory context due to the activation of TCD4+. And the current treatment concerning rheumatoid arthritis are based on the use of monoclonal antibody, but is very expensive, it's 15,000 euros per year and per patient. So, due to these properties of our dendrimer, we believe that this dendrimer can be the first drug to fight against all aspects of rheumatoid arthritis. So just I would like to show you briefly what we did in this field. Okay, so we validated this on a model mice developing for rheumatoid arthritis-like inflammation, and we observed that we have 100% of remission for all animals, working intravenously orally and without any kind of formulation. So we inject or we gave orally to a mouse 10 milligrams of dendrimer once a week. And if we have a look to the, when we are using intravenous injection, if you have a look to the yellow curve, you can see that we need 6 weeks to have the total remission for all animals. Now, if we are working orally, you can see, this is the green curve, that we need 5 additional weeks, but anyway, we have also a total remission. And so just to illustrate that, you can see here 2 images. First, image of a mouse model of rheumatoid arthritis. You can see the inflammation, and after treatment, you can see that the mouse recover the normal size of his path. Another thing here, for when we have a rheumatoid arthritis, you can see the cartilage erosion no synovial membrane, and after treatment, you can see that we are recovering the cartilage and the synovial membrane. So this is an example of what we can do with polyanionic Phosphorus Dendrimer. So now we had the heat. So when we have a heat, we try to have a lead optimization. And we did that. And for that, we were able to prepare around 200 different types of Phosphorus Dendrimers. For example, we start with generation 1, which was the heat number 1. So we increase the generation 2, generation 3, always with the same terminal group, this ASA bisphosphonic group. We change the density, moving from only 2 ASA bisphosphonic group on the surface up to 60 on the same generation 1. We change also the nature of the branches. So this was the branch we had inside the dendrimer. So you can see we were using all the branches, carboxylane, PAMAN, polylysine, PPI dendrimer, and also we changed the nature of the terminal group on the surface. And the best compound was the first one we were using, that is to say the compound which is generation 1 with this terminal bis azaphosphonate. So how we can explain that? Well, in collaboration with Giovanni Pavani in Switzerland, we did some molecular dynamic simulation on 13 different dendrimers, and there are the results here. Just to summarize, a very important point is if you have a hydrophobic interior, it's active. If you have a hydrophilic interior, it's absolutely not active. When you have active dendrimers, let's say, for example, here and here, you can see that it's occupy a half sphere, and all the terminal group are in one direction. When you have a not active dendrimer, it occupies a full sphere, and the active species on the surface are spread out on all the surface. So let's move now very quickly to another anti-inflammatory properties, now using polycationic Phosphorus Dendrimer, small interferon RNA dendriplexes. For that, we were trying to see to use siRNA therapy for treatment of lung inflammation. So very briefly, chronic obstructive pulmonary disease, as you can see, there are 328 million people suffering from these diseases. And it was already shown that the cytokine TNF-alpha play a key role in the inflammation process during the chronic obstructive pulmonary diseases. So our goal was just to deliver to the lung anti-TNF-alpha small interferon RNA, choosing our polycationic Phosphorus Dendrimers as cargo, which can protect, therefore, siRNA against degradation in biologic fluid and increase their cellular uptake and favor their subcellular distribution. So, briefly speaking, we were working with a number of polycationic dendrimers. Here, just 2 examples. Very important. We have, in each case, dendrimer of 3, generation 3, but in one case, we have morpholinum group on the surface, and here, pyrrolidinium groups. All these 2 compounds are perfectly soluble in water. So here is the size of the dendriplex. Here is the zeta potential. And just a remark, you can see that the dendrimer having pyrrolidium group have a higher zeta potential. This is probably due to the pKa of the pyrrolidine, which is higher than the pKa of the morpholine, and therefore at the pH 7.5, the dendrimer with pyrrolidium group are have much more charges. So if you have a look now to the electrophoresis, you can see that with pyrrolidium siRNA dendriplexes are very stable. This is not the case when we have the dendriplex involving morpholinum. Now, what we did, here is the treatment of cells. We have no treatment. We are working with row 264.7 cell is a macrophage cell inflammation model. So you can see if we add a free siRNA, we have nothing. If we are working with morpholinome, the dendriplex, you can see that there is no transfection into the cell, but the dendriplex stay on the surface of the membrane, making aggregation. But if we are working with dendrimer with pyrrolidinium group, we have a nice transfection, and as you can see here. And you can see here also the cellular uptake of dendriplex in these cells. As you can see, with the D2 dendrimer, we have largely better results. Here is another interesting study, which is a TNF-alpha inhibition after stimulation by LPS in these cells. You can see again that we have nice results with dendrimer with pyrrolidinium group, and in vivo, very briefly, you can see that we have also interesting result when we are working with dendriplex with pyrrolidinium group on the surface. Last, I would like to show you an anti-inflammatory properties now of neutral Phosphorus Dendrimer is an additional example than the example which was presented by Valentin Sina. For that, as you know, the recognition of interaction of MANLAM, that is to say the mycobacterial manosylated lipoarabinomanam with the immune system receptor promote Mycobacterium tuberculosis phagocytis, but also, and this is important, as an anti-inflammatory effect, depressing the immune response of the host in favor of the survival of the invading pathogen. And therefore, if you have a look to the MANAM monomer, it has practically no activity, but its self-assembly interacts with a large binding constant with several mannose receptors. And so what we want to do is to mimic the action of the self-assembly of MANLAM. And for that, we prepare a variety of different types of dendrimers. So for example, we have here a dendrimer generation 1 with 12 mannose. Here, a dendrimer generation 2 with 24 bis mannose, and here a dendrimer generation 3 with 48 3 mannose. And if we have a look to the binding of monodendrimers to membrane space, DC sign, this is the IC50, you can see that something which is important is the fact that there is a strong influence of the generation and of the number of terminal functions. And you can see that we have excellent results working with a dendrimer generation 3 or 4 with this mannose unit, or with a dendrimer generation 3 between 48 3 mannose unit. And here you have an example of the result concerning the lung section of a wild-type mice stained by hematoxylin and eosin. So before treatment, you can see the alveolar wall thickening and inflammatory cell infiltration, and after treatment, you can see the reduced inflammation. So through these three examples, my intention was to show you that with dendrimer we can do a different way of administration. I have illustrated the way of intravenous route, oral route, also the nasal administration, but there are some other possibilities we were developing, but this is another topic in which we are working with inhalation administration and transdermal diffusion. And this was explained and fit perfectly with our concept of dendrimer space, which we have developed into review recently. So before finishing, I would like to thank people who were working on this field. First, Serge Mignani, who was a former director of the medicinal chemistry in Sanofi worldwide. Also, I would like to thank Rémi Poupeau, Marie Poupeau, and Jean-Luc Devignon, working with Cédric Olivier Turin in our group concerning polyanionic dendrimers. Concerning the neutral dendrimer is a group from Toulouse, Germain Puzo, Jacques Brandy, Jérôme Ligou, and Emmeline Brett, and concerning, therefore, the dendriplex, that is to say the use of dendrimers as cargo, I would like to thank Elias Fatal, Adam Bourne, and Nicolas Psati, which are working with us in Paris. And of course, most of the work was done in Toulouse by mainly two people, Cédric Olivier-Turin, working on polyanionic dendrimers, Régis Laurent on polycationic dendrimer, and many people know here Anne-Marie Camenade, who is now the director of the team. Thank you very much for your kind attention.
Thank you, Jean-Pierre. As you can see, he has probably one of the most elegant and extensive examples of CNDP engineering. You played with all 6 parameters. And in fact, I saw a very nice nanoperiodic property pattern there. Where you had activity as a function of size as opposed to just surface chemistry. So those are very elegant. So I want to get those examples in my collection. Now, time for a question. Hans.
You study, first of all, very, very nice talk.
Thank you.
Very much for your talk. Did you study how these dendrimers, the phosphorus dendrimers, are internalized into macrophages? I thought it was a slide, but can you explain us some more?
I will show you.
Is it through receptor mediated, or it's
Let's say, what we were able to demonstrate that we have what we call a monocyte activation. Okay, this is the first step, and we change the size and the granulosity of the monocyte, and also we change the lifetime of the monocyte. You see, for example, this is in white, the lifetime for monocyte, only monocyte, and when we add dendrimers, you can have a look here, we increase the lifetime of the monocyte. This was the first step. And no, it's not here. So we did the following experiment. We were able to demonstrate that the first step is recognition of the TLR2 on the surface of monocyte, then after that internalization. And we did that doing FRET experiment with dendrimer tagged with the fluorescent group and with the TLR2, which was also tagged with the fluorescent group.
So you can prove that this through TLR2 internalization through macrophage?
Yes, that's right.
Okay, thank you very much.
Yeah.
Hi, very nice talk. Can I go back to your siRNA
Yes.
dendrimer complex? You mentioned you went in vivo into mice, and I presume that was intravenous delivery. Can I ask if you found any differences or any changes in the liver, knowing that the liver has high tropism for dendrimers?
Pardon?
In your in vivo model, your siRNA
Yes.
dendrimer, did you see any changes in the liver when you...
No, absolutely no. Absolutely no.
And you went intravenously with these dendrimers?
Yes, yeah.
Okay.
Yeah.
It's quite surprising because I work
Yeah.
with dendrimers in the liver, and it has enormous tropism to the liver.
Yeah, yeah. Yeah.
Considering it's an siRNA.
Yeah, yes, sure.
Well, that's fascinating.
Not in this case. Not in this
Okay,
case.
brilliant. It was
It
fascinating.
was surprising for us too.
Yeah,
Yeah.
My talk will be about siRNA.
Oh,
in the liver,
okay.
And
Okay.
it would be interesting
Okay.
to see why the differences exist between
Okay.
SI and
Okay.
SA.
Okay.
Thank you.
I just want also to say that we have a very interesting result using this kind of dendrimers against tumors. But this was not the topic of my talk today. But in this case, when we have against tumor, we have not the same phenomena than here.
One last very quick question. You have beautiful CNDP engineering. Obviously, you've optimized your structure, activity, relationships. My last question is, have you had an opportunity to do cGMP upscale for clinics?
Yes, we are working on that. You know that I have a company, and just to on the GMP. No.
Thank you. I wanted
Okay.
to get that message out.
Okay.
Thank you very much.
Thank you.
Let me